This morning, we're going right into our plenaries. We have 3 plenaries today. The first one is going to be about health, breakthroughs in health. And here to introduce the session is Leyla McCurdy. Leyla is the chair of Eco-America's Climate for Health Leadership Circle and senior advisor for the program. Welcome, Leyla.
Thank you, Megan. Good morning. I'm delighted to have an opportunity to say a few words, but I have to say I'm not so sure that I'm delighted about following Senator Whitehead. I'll try my best. I'm a different category, so please think from that perspective. Again, good morning, and thank you so much for being here at this Leadership Summit. We are all here because we are looking for ways to engage in breakthrough solutions for climate change, which is, of course, is the greatest public health threat of our time. We as climate leaders understand that addressing climate change will improve health overall, especially for the most vulnerable, and will lead to health equity. And we can use our trusted voices to promote health, justice, and equity through climate solutions. And that's exactly what the Climate for Health initiative is striving for. Climate for Health is a national initiative led by a diverse network of health leaders from across the health sector. We offer tools and resources to health leaders to inspire and empower them to take action for climate solutions in order to build public support and political will for urgent climate action. We have an outstanding leadership circle. It's a group of 40 individuals representing 26 organizations, and we have a wider network of health partners. And many of you are here today, and I want to thank you for your continued leadership and support. And these are some of the logos that we were able to fit in one slide to recognize our amazing partners. So with the help of our leaders and partners, we continue to make progress and refine our strategy for effective solutions. Last spring, at our annual National Climate and Health Leadership Forum, we reaffirmed our priorities as visible climate leadership, mitigation, advocacy, collaboration, and collective action. And collectively, we agreed that health professionals are trusted messengers on climate change, and we need to use our voice. There is a need for national health agenda on climate change that health professionals can support. And we expressed our desire to build an inclusive health movement on climate solutions that addresses climate and environmental justice. And we have seen significant momentum building towards these concepts over the year. As you know, in the fall, we saw a sea change with the release of several reports, including the NCA4, IPCC report, that once more added to the scientific evidence of something we are already seeing and feeling, the impact of climate change on our communities. And health groups are rising up. For example, and again, this is a mixture of various things that we put together to give you a glimpse of what's going on in the field, and a lot of them are familiar to you. But I wanted to point out to the example of the global health call, the Global Health Call to Action, which was released last October at the Global Climate Action Summit. It was endorsed by over 100 organizations representing 6 million health professionals in over 125 countries. We, Climate for Health at Eco America, as well as many of our partners, are signatories to that. Again, this is just one example of a large group of activities undertaken by the health community. And unfortunately, as I said, this slide captures only a few of the amazing work that our partners are doing. Because of time limitations, I'm not going to be able to recognize all that amazing, outstanding work, but I want to extend my heartfelt thank yous for all the work that's going on out there. I also want to highlight just a couple of upcoming key Climate for Health partnership activities. We are planning to provide the Climate for Health ambassadors trainings at national partner conferences, including the American College of Sports Medicine later this month. Hopefully some of you will be there. And immediately following that, at the National Environmental Health Association's annual meeting in July. So again, any information you would like to have about these conferences, any interest from your local partners that may want to participate in these, just let us know. We are also planning to host a regional training with Physicians for Social Responsibility, and we also are talking to many of our partners for additional trainings, as well as we will be doing this training virtually with, hopefully with many of you, so that we can have climate ambassadors from the health community out there doing the great work that many of you are already doing. Also, later this year, we will be releasing our Moving Forward Guide to help this sector move towards 100% clean energy. You will be hearing from us about this, and we will be reaching out to you, some of you, if you're interested, to review it as peer reviewers, and then, of course, a wider community we will be asking for your help to engage in the distribution and implementation of this Moving Forward Guide, and looking forward to working with all of you on that. With all of these things going on, there's great opportunity for all of us to collaborate, and a breakthrough will take all of us, and we look forward to working with all of you to achieve that. Thank you so much for your commitment and leadership. Next, you will hear a moderated discussion from an outstanding panel of climate, health, and justice leaders. Now it's my honor to invite the panel up here and introduce one of the nation's most influential physician leaders who will be moderating the session, Dr. Benjamin. And the panel, please. I'll take a few words and introduce you. You need no introduction.
You don't need introduction. I'm good.
You're really?
Yeah, I'm good. Yeah.
But
George.
But can I at least?
Be my guest.
Thank you for serving on the Eco America board, for all your leadership, not only as a board member, but also your, American Public Health Association's tremendous great work and partnership with Eco America and Climate for Health under your leadership.
Thank you, Leyla.
Thank you so much.
Well, good morning, everyone. Good morning. Let me just thank you very much for allowing us to be here. And I'm going to do a couple things. APHA has been playing in this space of climate change for over 2 decades, specifically. And, we just announced last fall that we were rolling out a new climate, health, and equity center. 3 key words: climate, health, and equity, as part of our efforts. And one of those efforts I just wanted to share with you is that we're going to be having our Speak for Health, which is our new advocacy campaign, in July with a focus on climate change. And this is part of our effort to try to build the youth young folks that are involved in public health practice and get them in climate change. So they're going to spend a day basically learning both how to advocate and learning more about climate change. And then we're going to take them to the Hill so they can practice the craft and skills that they just learned. This center is an important center. This is one of the areas in which we're supporting. You can see we are also going to provide a few scholarships for people in that center. So I just wanted to use this time just for that first commercial announcement. I think next, what I just want to say is, quite frankly, that the science is clear, that climate change is here today, and it's impacting our health today, and is preventable. And I think if you leave this with no other messages today, from my perspective, is to understand that this is not an issue for the future, that this is an issue of the impact of the health and well-being of our population today. You know, I think saving the polar bears is wonderful, and I'm all for saving the polar bears. I'm all for reducing the amount of ice that's melting around the world. But I'm hoping that we will still be here and still have the opportunity to enjoy the ice and enjoy the polar bears. But as we think about climate change, it's very important to understand that some of the mitigation and adaptation things that we're doing certainly have a co-benefit for health. But the real truth of that is, it's all about our health, okay? That health is not a secondary issue here. It is a primary issue. So to have a discussion around this, I have three just amazing people. I have Dr. Gale Christopher, who's currently the president and founder of the NTNU Center for Healing in Nature. She's the chair of the board of the Trust for America's Health, and prior to that was a senior advisor and vice president at the W.K. Kellogg Foundation. Next to her is Alonzo Plough. Alonzo is a long-term public health practitioner and is currently the chief science officer and vice president for research, evaluation, and learning at the Robert Wood Johnson Foundation. And then we have Dr. Dyjack, who also has over 30 years of practice in public health. He's the executive director of the National Environmental Health Association. So with that introduction, I'm going to ask each one of them to give us a short opening statement, and then we want to have a conversation. And you're welcome to do it from there if you want, or you can come up here.
Good morning. I'm honored to have been invited to join this panel. Most of my work over the last, 30 plus years has been focused on health equity and ultimately addressing the fundamental undergirding belief that has allowed us to create the inequities and to sustain them. And I believe that that is the notion of a hierarchy of human value, the notion of racism, and all the other isms that it opens the door for. So it was kind of an aha moment for me when I realized that there was such an intersection between the work to overcome the belief in a hierarchy of human value and the work of moving our country to be more active and more engaged and to really get a hold of this threat of climate change. And the intersection is amazing because most of the frontline communities, most of the people who are really suffering from the immediate changes in climate, they are disproportionately communities of color. And they suffer disproportionately in terms of the burden that they bear. Whether it's the coastal communities down there in the South or in the Northwest, or even some of the flooding in the Midwest, communities that are low income and communities of color bear a disproportionate burden today for the effects of climate change. And so part of what we have to do to mobilize the advocacy and the activism is to come together as one community and to jettison our belief that some people have more value and more worth than others. Now, this issue of the health consequences, like Dr. Benjamin, I'd like you to take one concept home with you today and really live with it, and that is that we are spending $3 trillion annually on chronic disease. $3 trillion. I would say quickly that I think we've been a little too abstract in our framing of this challenge, and we've asked people to care about the planet when we know they care about their pockets a lot more. And so I think what we have to do is create a more robust business case for mobilizing. And that business case has at its heart the health consequences of climate change. If we do the numbers in terms of the asthma and the chronic diseases and the stress-related diseases and the mental health consequences of being exposed to disaster, we will come up with a scale of costs that will make sense to the greatest skeptics. So they've asked us to make our opening remarks brief, and I'm going to honor that request. But I would suggest to you that the biological, physiological links between the stress of climate change and vulnerability to chronic disease, those links are clearly established in the literature. And we need to be more robust in our framing of this issue as a health issue which is costing our nation far too much. Thank you.
Good morning, everybody. You're going to hear a lot of common themes, I think, in our presentation today. I'm speaking today from the Robert Wood Johnson Foundation, but as I like to say when I give these talks, I'm a relatively short-time philanthropist of a few years, 5 or 6 years, and a long-time community health, local public health practitioner. So my remarks are certainly going to talk about what we as a sector are trying to do, but they really draw on my 35 years of working at the front lines of public health and seeing this issue manifested in the kind of chronic disease disparities that Gail just talked about for the entirety of my public health practice. So at the Robert Wood Johnson Foundation, I mean, we are working to build what we talk about and call a culture of health, where everybody in America has a fair and just opportunity for health and well-being. And we know we can't do that if we don't address emerging and known facts that are threats to health. And climate change is one of those threats. It is a major threat to health and well-being. As Dr. Benjamin's slide showed, it affects many known health conditions, but we need far more awareness to understand this pervasive influence of climate change on health. And if we don't address that, we are just not going to have the kind of healthy future that we need for the generations to come. And it also requires a different framing of health. Often people think about health and they think about the way our default $3 trillion a year system deals with this, with its illness care in hospitals, which are important. But when we are talking about climate change in health, we're talking about community health, we're talking about large disparities in health outcomes based on this, and something that we need to address collectively, cross-sectorally, as a nation. I'm just going to reinforce a little bit what Gail talked about. Climate change magnifies these inequities, these health inequities that prevent people from having equal chances. Climate change exacerbates the health disparities based on race, class, income, other marginalizing factors that don't allow people to have the best health that they should have. And we need to understand that addressing climate change is an absolutely critical way to address health inequities equities and build health equities and increase that awareness throughout the country. Because again, whenever we see a climate change related disaster, we see a disproportionate impact on low-income communities, communities of color, tribal communities, again, which exacerbates existing health inequalities that those communities face every day. I think that what I want to emphasize is I think there's a growing awareness of this. We're pleased to sponsor an issue of the American Journal of Public Health that's going to highlight this. The foundation is spending a significant amount of time to raise this issue as a critical issue, along with many of our other partners in philanthropy. And there are solutions to this, and we want to lift up that. I'll kind of close with talking a bit about what we're trying to do now and what we're calling our Health and Climate Solutions Program. We're funding a number of communities, urban and rural, around the country to understand what kind of community-based collaborative strategies are really working. How can we bring the environmental justice community into this movement building to improve our awareness around health and climate more than we have done? And our hope is that we can lift up and unearth these ongoing collaborative strategies that are making a difference and extend this conversation about the importance of working on climate and health. A couple other things I want to leave you with that we're working on is that we're working very closely with the National Academies of Science around the Gulf Research Program and a particularly hard-hit area on the weather impacts of climate. We are working for a long-term strategy with them to improve community resilience and community engagement in a preventive approach to building resilience and climate resilience in the South and Southeast. So I look forward to your questions and comments. Thank you.
David.
Folks, I hope it's okay if I remain seated. I wanted you the opportunity to check out my cool socks, and I can't do that if I'm standing behind the podium. I would like to begin by sharing with you a story that clings to me like a leech. It was in the mid-90s, and I was giving a lecture in a lecture hall just like this to first and second year medical students. It was on environmental health. And I talked about perchlorate in drinking water, which was a problem right there on campus. I talked about lead-based paint, which was poisoning Hispanic children literally within walking distance of the lecture hall. I described air pollution in the Southern California area of the Inland Empire, which competes with Houston for the worst air quality in the country. And I ended by pointing to the ceiling and saying, the ceiling in this room is 3 to 5% chrysotile, which is a type of asbestos. And in a place where there are earthquakes, you ought to think about this, you young medical students who want to become physicians. And I felt I gave a presentation that resonated with every single person. No one was flying paper airplanes. There were no cell phones at that point in time. I had everyone's attention. And then I did the thing that most professors dread. Are there any questions? And for any of you that come from the clinical professions, you know what the single question was. What's on the test? That, my friends, was the single question. So number one, I believe that if we want to have breakthroughs in health, credentials in medicine, in dentistry, in public health, in nursing, need to include climate and health criteria built into them. That's my first belief. My second belief is that we should not confuse expertise and leadership. Those are two different things. Thank you. We should focus on the principles of influence, how to work with human beings that are influencers and to get them to come around to our reasonable kind of expectations. Affect heuristics. Why do people think the way they think when they draw their opinions? Think about measles and think about affect heuristics. And then number three, we need to play well on teams that we don't lead. Okay? We need to be good followers as well as good leaders. There's a lot of focus on dynamic leadership. Let's be dynamic followers. And frankly, there's a lot of great stuff out there by citizen scientists. We should join their party, right? We may have the credentials, but there's really good stuff, and if I had another 3 minutes, I would describe it. Number 3, my third belief is that we need to change ourselves before we ask other people to change. NEHA as an organization is committed to decoupling itself from fossil fuels. We're looking at conferences like this where we can have carbon offsets. All of our meetings, which have 1,000 to 1,500 people, are walkable. We have made the conference paperless. We secure food from local farmers so that they benefit from our presence. We have meatless options, and we're avoiding hotels that have single-use plastic soap and shampoo containers. All little things, but we have state affiliates all across the country, and they are paying attention. And they too want to do what the mothership is doing. So I'll close by saying NEHA as an organization does not desire to mirror the state of the profession, the environmental health profession across this country. We want to mold and shape and form it so that it is more productive, more useful, and more reasonable in the future. Thanks, Dr. B.
Thank you. So I thought I would put you on the spot about a learning that I had when I was a local health officer here in Washington, D.C., where I learned very painfully that there is a political structure in the city that's elected, and another political structure in this town that is the business community, but that the real political structure in this town was Mrs. Jones in Ward 7 and Uncle John in Ward 8, who were the power brokers in those communities, that if I wanted to get anything done as the health official in this town, I had to go break bread with Ms. Jones, because Ms. Jones knew everybody in the community and she could mobilize the community. Or, Reverend Foster, who, through his congregation, was able to mobilize many, many folks, and in fact had a larger health ministry than the health department. So how through your experiences have we really worked very hard to engage the true power brokers in communities? Because we always have this discussion about what the power dynamics really are. They're in those communities. How do we engage them in an effective way around this issue of climate change?
So if I could speak on behalf of the environmental health profession, it is perhaps the one public health profession that spends most of its time in the community, working with the regulated community, working with daycare, working with elementary schools, looking at antibiotic resistance issues in hospitals. I believe my profession has not been as savvy or disciplined around working with community members as much as we have the regulated community. And this is something we'll be encouraging our members to do on a more systematic basis. About 1/3 of our members come from the private sector. And Dr. Benjamin, we're trying to determine how best to engage them more effectively so that they can echo the kinds of messages that we would like to get across to our community. And they know their communities well. There's a lot we can learn from them.
Yeah.
Yeah, I think the answer to this question is to be found in the history and the current engagement of the environmental justice community. We tend to think in a future focus when we talk about climate, but the severe weather issues are not future, they're current. Mm-hmm. And the environmental justice community has been mobilized, I guess it's now about 40 years, I think, or more, helping communities to cope with the consequences of severe weather issues and climate issues and failing infrastructure, as you pointed out, in so many levels. So I think you have people who are affected directly by the challenges and whose inner drive is to survive and to thrive in spite of that. So this environmental justice movement has to intersect with the more traditional environmental health and climate change movement to bring, I think, the felt urgency, the imperative for action now. We don't have the luxury anymore of thinking of this in a dichotomous way. These communities are suffering today, and the cost of that suffering is today. And so bringing together those who are feeling it right now today to help expand the circle of mobilization and if necessary, lobbyists and activism to do the broader changes. So I think you have to bring all of these different strands together.
Alonzo.
Yeah, I mean, in public health, anything that we really did that mobilized a great change and awareness happened at a community level. Those, whether it was AIDS, HIV, all of the big systemic challenges that we have been successful in have started with that kind of movement building. When we discount lived experience in our analysis of how to solve a problem, we aren't going to get at the problem. And I will just echo the importance of the environmental justice community has been linking lived experience, inequity, a political economic frame, and an organizing frame to dealing with climate issues and inequitable issues around environmental exposures. David, you mentioned citizen science. All of these are the elements to bring people in communities who experience these problems and have all kinds of insights at the level about what it takes to address these problems and also become a political base for broader systems change. It's totally essential, a major part of the kind of movement building and change we want to make.
How do we help them connect? You know, part of our challenge is here, of course, helping people make that connection between what's happening today with the climate and their health. Lots of other factors involved as well, but how do we help them make that connection?
The program that we're doing, we're really using this window of extreme weather events, and you talked about it too. And everyone in the room knows those manifest themselves in different ways. We did some work with some communities in Miami, and that's the sea level rise is palpable. I mentioned the work on the Gulf. That extreme weather event is a good window for them to see it in their lived experience and the impact of climate and health, a little bit more than sometimes the abstractions in which we talk about it. So we are in a communication strategy that we're trying to use. We think that the window of extreme weather events links the country together because many different geographies experience this. I live in LA when I can, though I work in Princeton. The fires that we had that got into LA City proper are just speaking to the greater intensity and magnitude of the impact of climate on that particular parameter. So we think that's a window that allows people to understand in terms of their own immediacy the urgency of addressing climate change.
Yeah, I believe we need to take advantage of teachable moments as well. We should be the first voice and the loudest voice when a teachable moment occurs. And generally in public health, we're very cautious. It's the t-test and the p-values in the back of our minds from graduate school. It's like we want to be 95% certain that we're right. And by the way, we're the only real profession in the prevention world that's doing that. We hold ourselves to such a high standard. I think we need to relax just a little bit and be first in the room and to take advantage of that opportunity.
Yeah, I agree. I would just add that, and here I saw this intersection. You know, when we talk about the exposures to racial discrimination, whether they are structural racism or daily discrimination or economic, impact, we're ultimately talking about the stress response and how this increased stress and allostatic load burdens the immune system and makes people more vulnerable to not only acute disease, but to chronic disease. And so I think there's that conceptual nexus for us in this work as well. Whether you experience a severe weather event or you're a firefighter who's fighting a severe weather event, or you lose your home, or you're afraid that you're going to lose your home, or you're getting excess lead. I mean, all of these things ultimately translate into a physiological, biochemical stress reaction, and being in that state of an increased allostatic load is simply going to wear the body down and increase the chronic disease burdens, whether it's hypertension or diabetes. So I think this is a moment, a teachable moment, for us to develop a higher respect for what our capacity is for tolerating protracted and prolonged exposure to stress. And I think in terms of communication, we need to help people frame this as affecting them now, their mental and physical well-being.
The challenge for me is, that I spent the first half of my career practicing emergency medicine, and one of the lessons that I learned is that rich people die the same way as poor people. Dead is dead. Exposure to environmental pollutants impacts, in some ways, the well-to-do as well as it does low-income individuals. The well-to-do have capacity maybe to recover because they have maybe have air conditioning in their homes, or they may have filters in their air conditioning systems. But their children are just as exposed to allergens in the air. If there is a hurricane, it wiped out as many well-to-do homes, right, in the South, in Florida, in Texas, and even in Puerto Rico, as it did in low-income communities. The real challenge here is, of course, the recovery time and their ability to recover. How do we get folks that see themselves as the elite to understand this extraordinary risk is to them as well, so that they'll stop with some of the nonsense of not supporting this issue?
I believe that we should try to identify positive deviants, that is, individuals in this country who are part of the elite that are already on board. It's not the message, it's the messenger in many cases, and let them carry that message. If someone sees me show up in a bow tie, their eyes roll in the back of their head. Trust me, I spent a lot of time in red states. I need to dispense with the bow tie when I go there, frankly, because it doesn't serve me well. Okay? Having said that, though, really it's the right messenger at the right time, and if we can find those positive deviants, I think that would help us. And then let's learn from them, what works, what doesn't work, and then scale that up.
Well, I know the Equal America has worked very hard, and this shout out to Bob on some of the communication tools that they've used, that we've created as an organization to try to address folks where they are. And so, Bob, just a shout out to you for those communication tools. Those are very, very helpful when we use those. Alonzo?
Yeah, I know. Being in the emergency response field for a long time, the thing that was both frustrating but also kind of an opportunity, there's a great deal of togetherness in real time in a disaster for the same things that you said. We are all in this together at the disaster. But then that togetherness fades. And it's something about keeping that sense that we are all in this together, not just during the time when you've had the flood, the hurricane, the wildfire, but building on that togetherness that is almost always there when you have the disaster, and keep moving that forward and using that as a lesson for what you need to do as a community, elites, marginalized, to mitigate, prevent those occurrences in the future. Have that longer tail of togetherness after disaster.
And if I could just pick up on that, again, one of the lessons we're learning from the racial healing work, we can live in our various separate enclaves, and we don't have authentic relationships across professional and racial and geographic lines. And we have to think of the work of building those relationships, of healing our collective sort of spiritual body, in terms of our sacred interconnectedness as a human family. We have to think of the work of that as real work.
Right, exactly.
We have to build community. I'm going to care about you if I care about you. If I know you, if I've seen you, if I've heard you. And so I think, we can actually build that into our strategies of actually bringing people together who are very different and sharing narratives, because narratives move the heart. We have all the data in the world, but that doesn't really change our behavior. It's the story, it's the narrative, and it's also the understanding that, my child might suffer, but my child, if I see your child suffer, I should have empathy for that. So building capacity for empathy and compassion, building the sacred interconnectedness of the human family, I believe that's our work in this 21st century.
Absolutely.
Yeah, if I could add, from Gail and Alonzo, those were real gems. The action is in the space between the professions. The action is in the space between communities, however you define those. And I think you guys said it really well. We need to spend more time outside of our bubble and less time talking in the echo chamber of social media and to ourselves. It's time to move outside, so I appreciate your comments.
Let me reach into the audience, because I want to start building community here, because it's not just the four of us on this stage. In the audience there.
Thank you for this session. Dr. Benjamin, you laid out on your slide a set of dangers of climate change, and I agree with all that. But it seems to me that the much more powerful argument about the public health benefits of action is the elimination of fossil fuels, which are killing people by thousands in this country, rich and poor alike. And if we can wean ourselves off of fossil fuels, combustion, the production, the use, we're going to have public health benefits that way dwarf anything that we're going to talk about climate, which frankly we're not going to be able to change in our lifetime.
Yeah. Well, thank you very much for that. We're not opposed in any way. We're not giving you a different message. Public health likes to look at the root cause of things. And yeah, the root cause is our utilization of fossil fuels, the burning of fossil fuels, the rise, which has resulted in rising carbon dioxide, et cetera. So while I didn't talk about the etiology of this, which is the burning of fossil fuels, that's absolutely true. And there's no question about that. And we make that case in most of our communications. There's this gentleman back here, and there's a young lady in the back, and then I'll come over here to John.
Thank you. When we were fighting the effort to destroy the California global warming statute, Tom Steyer and some other people spent a lot of money on research. And at that time, which was several years ago, found that people didn't care about climate change, but among the top two interests, one of them was health. And I have found that the space between the disciplines is absolutely critical. So I'm grateful for you saying that. I'm just wondering, how do healthcare professionals, increase their involvement, and how do they start screaming the alarm? Because too often it's just a wee small voice, and it's not the voice that I would like to hear.
Good point. Do you want to comment first, and then
I believe it's associations can be leaders in this issue, and I genuinely mean that. And associations can deliberately and profoundly partner with other associations, whether they're health or not health related. And I think that we can only do what we can do. Let's not get depressed by trying to take on too much. One bite of the apple. And I know in this city, the health associations, I feel, are really partnering now in a way perhaps they weren't 5 years ago when I was here in an earlier professional iteration. You should take heart in that. Everyone's pulling together. Sometimes we benefit, sometimes somebody else benefits. But I think that's a part of the solution. When we speak in one voice, or largely one voice, I think it really sends a message across the country about the importance of this.
Can I just add that the nurses have been doing that in
Absolutely.
a way that is absolutely whatever. I would appreciate it greatly if physicians became nearly as active as nurses.
Thank you. I think that's why Mona put together the Physician Consortium on Climate and Health that they've done at George Mason. Again, applaud their efforts. So there is absolutely trying to get that knowledge out there and build that activism. Out there in the audience there, in the back. Sorry, I can't see you.
My name is Dyjack, and I'm a professor of environmental science at Ferrum College in rural southwestern Virginia. I represent the Episcopal Church's Creation Care and Environmental Racism Task Force. I also sit on the board of a federally qualified health
FQAC.
FQAC.
What I'm not hearing today is one more component, and that is the agricultural sector. We just started a One Health minor because we can't find it in academics
Well, I can tell you that on the advocacy front, APHA has very much been involved in the One Health movement, led by our members of our association who are in veterinary medicine and interested in food nutrition have gotten together. So there are activities happening on One Health around the country on the advocacy front.
Yeah, we do a lot of leadership training. I'll just give one example. For years and years, we had a program that trained clinical leaders, but they were only physicians. That's been changed where they now include all health professions, including veterinarians, around trying to generate leadership in connecting these different disciplines. You know, that's a start. But I agree that lack of connection it plagues us on the research side because we don't have those kind of transdisciplinary approaches to these problems, and it doesn't inform our practice. But that's a little bit about what we're doing, putting different leaders together early in their career so they can learn from each other.
Yeah, and NEHA has submitted as a co-applicant to the State Department to work in One Health with the University of Minnesota. This is around workforce capacity building on the issues that you've just described. I'm not saying it's the end-all, be-all, but it's a start for us.
I'm going to get this one last question from the audience. John, on that, and then...
National Institute of Environmental Sciences. We talked about NCDs, and when we think about NCDs, we're usually talking about lung disease and heart disease, diabetes.
Non-communicable disease.
Yeah.
Epidemics of suicide, drug abuse, and mental health disorders. And I think that these things are linked. And I know we're going to be talking later about bringing in the faith community
Next panel.
of the spiritual world. How do we address what is really, I think, a very profound crisis of spirituality and mental health in the same breath that we are addressing health inequities and disproportionate exposures and distress?
I can tell you that our faith caucuses have very much been involved in a lot of our environmental health efforts at APHA, and this has come up in some of the discussions, I believe, in our tribal think tank, where we've been working with the Native American community as well. But let my colleagues, because we need to close.
We've got to close. I would just thank you for the observation and the question, and I used the word spiritual earlier. I would just say that the first sort of theoretical underpinning of the racial healing work we do, the RX racial healing work, is a highly developed capacity for self-compassion through mindful awareness. I believe that we cannot give what we don't have, and if we don't have compassion for ourselves, deep compassion that's been developed through spiritual discipline, we tend to project our fears and our anxieties onto others. So this is the real work of the continuum of development, and I believe compassion is the central missing element in our society. Regardless of religion or faith, ultimately the commonality of almost all of the world's faiths is this development of the capacity for compassion and love.
You know, that's a great question. I was wondering what's going to link. I spent the last 2 days at the National Academies on the opioid crisis. What links that crisis to this crisis are those things. That despair at a cultural level, alienation, marginality, you know, I couldn't agree more.
Would you please give a great round of applause to Dr. Gale Christopher, Dr. Alonzo and Dr. Dyjack. Thank you very much.